CataractCoach.com. My 100-year-old cataract patient. The case is much tougher than you expect because of the delicate ocular tissues. So let's start the case off here. Here's our paracentesis. The nucleus doesn't look too bad. Well, that's because we really exaggerated the red reflex with a microscope and then also here on post-production video editing. Preservative-free lidocaine going inside of the eye. We'll put our viscoelastic, very important on the dispersive viscoelastic, because this patient, of course, has a 100-year-old cornea and a lower endothelial cell count. There's a nice phacoincision. Now, important to get a big capsule rexus. Do not make some baby rexus. We need a big, generous capsule rexus because this nucleus, you think it doesn't look too bad, right? It's going to be a lot denser than we think. And that's just because of age. You know, nuclear sclerosis is age-related. There's that 5.5 millimeter rexus, a little bit of hydrodissection, and the nucleus, again, doesn't look too bad, but as soon as I put the phacoprobe in the eye, you're going to notice it's going to be tough to chop this thing. Now, it's not brunescent, it's not that type, it's the gummy type of cataract. That's what you get with age. Here's the phacoprobe going inside the eye, buzzing in, let's try to chop it, and nope. Oh well. So we're going to take our time. We're going to try to bring this nucleus up. I want to get the chopper behind the nucleus. So again, that gummy type of nucleus is going to take a lot more effort. We'll try to break off little pieces at a time and emulsify that down. Now let's talk about anesthesia. This patient's getting intravenous anesthesia, but just a little bit. Normally for most cataract patients, they get 2 milligrams of Versed. If they're a lightweight patient, maybe 1 milligram Versed. If it's a really very high tolerance patient, maybe 2 or 3 or 4 milligrams of Versed. This patient got 0.25 milligrams of Versed. No, I'm serious, 0.25, a quarter of a milligram. And yet it was a perfect amount. So as my anesthesiologist explained to me, these patients have a very narrow therapeutic window. So you gotta be very cautious. And that quarter milligram of Versed made the patient very relaxed and, believe it or not, induced total amnesia. The next day, the patient couldn't remember any of the surgery. So what a tiny dose. So there's the last bit of nucleus coming out of the eye. Nice clean capsular bag. Of course, we're showing you the video at 2 times normal speed. This was a little bit of a slower case for me. This case took me 8, maybe 9 minutes. And gosh, I know my young millennial viewers, they don't want to watch an 8-minute video. So we're showing it to you here at 2 times normal speed. Cleaning up the cortex. What's the key in this? Watch the rexus edge. I don't want to see the rexus edge moving. If I'm taking out cortex and the edge of the rexus moves at all, it means I'm breaking those 100-year-old zonular support structures, and I don't want that. Now, how much capsular bag polishing should we do here? And my advice here is less is better. Be cautious here. I don't want to do too much. I want to get out of here. I want to finish this case with the lens in the capsular bag, the posterior capsule intact, and the patient happy, and let's get out of this eye. I don't want to spend a tremendous amount of time here, so we're going to take our time. There's the capsular bag filled with viscoelastic. Here comes the IOL single piece of acrylic lens, aiming for a post-op refraction of around plano, and that can be delivered in the capsular bag. Let that open up. And again, we'll be super cautious. These tissues are 100 years old. We'll finish up the case here. Definitely take out the viscoelastic. Remember, the corneal endothelium is weak. We don't want to have these big pressure spikes in the post-op period. We got to be delicate as we can. And so cleaning up our viscoelastic, there you can see it's a nice capsular rexus, overlaps the optic for 360. This will be a beautiful result for this patient. And please don't tell me about optic glistenings or some other nonsense. This patient's 100 years old, and I promise she won't live to be 150. So putting the lens in good position, let's finish up the case. That is a beautiful outcome. So if you have a patient who's 100 years old, be super cautious, be super delicate. Those tissues are fragile, but you can deliver a beautiful result. And this patient had a clear cornea and beautiful vision on post-op day 1. Thank you guys for watching. Thanks for watching these videos. And remember to go to CataractCoach.com and sign up for a free daily email. We'll send you an email every day with a great video like this and other surgical pearls that'll make you a better surgeon.